Part 3. A. Medicaid, America's healthcare safety net. Before we can talk about changing America's healthcare system, we first need to understand one of the systems already in place. Most people have heard of Medicaid. Fewer understand how it actually works. It is often described as government healthcare, but that simple description leaves out an important fact. Medicaid is not one single healthcare program. It is a partnership between the federal government and the states. Created in 1965, alongside Medicare, Medicaid provides free or very low-cost health coverage for lower-income Americans. Today, it covers roughly 1 in 5 people in the United States, making it one of the nation's largest healthcare programs. The federal government establishes the basic rules, determines who must be covered, and shares the cost. Each state then operates its own Medicaid program, deciding many of the day-to-day details within those federal guidelines. This is where the American conversation often goes sideways. People hear government health care and picture one national system. Medicaid isn't one system. It's 50 programs wearing a trench coat. The federal government lays the foundation by establishing minimum eligibility standards and required benefits. The states build on that foundation, deciding how their individual programs operate. Some even use different names. California calls its program Medi-Cal. Tennessee calls its TennCare. Different names, different administration, but built on the same basic framework. Washington also helps pay the bills. The federal government matches a percentage of each state's Medicaid spending. That percentage varies from state to state, with poorer states receiving a larger federal contribution than wealthier ones. For people covered under the Affordable Care Act expansion, the federal government pays an even larger share. Who qualifies depends on more than simply having a low income. Every state must cover certain groups, including children, pregnant women, many people with disabilities, some low-income parents, and many elderly individuals who also qualify for Medicare. Where states differ most is in covering working-age adults. Under the Affordable Care Act, states were given the option to expand Medicaid to include adults earning up to about 138% of the federal poverty level. Most states accepted that option. Others did not. The result is something many Americans never realize. Two people with nearly identical incomes and medical needs can receive very different treatment simply because they live in different states. The same country, the same federal law, a very different outcome depending on which side of a state line they call home. What Medicaid covers also follows this same partnership model. Every state must provide core medical services such as hospital care, physician visits, laboratory work, nursing home care, family planning, and home health services. Children receive especially comprehensive protection through a federal requirement that covers virtually all medically necessary care, including dental, vision, and mental health services. Adult coverage varies much more. Services such as routine dental care, vision care, expanded mental health treatment, and home-based long-term support are optional benefits that each state may choose to provide. Some states offer comprehensive coverage, others provide only limited services. Although Medicaid is often thought of as a program for low-income families, it quietly serves another critical role. It is the nation's largest payer for long-term nursing home care and many home-based care services. For thousands of middle-class families, Medicaid eventually becomes part of the picture after years of savings have been exhausted by the cost of long-term care. That reality often surprises people who assumed Medicaid was someone else's program. Today, Medicaid and the related Children's Health Insurance Program, CHIP, provide coverage for roughly 74 million Americans. It is one of the largest healthcare programs in the country. It is also one of the least understood. The bottom line, Medicaid demonstrates that healthcare in America is already a shared responsibility between the federal government and the states. That partnership allows states to tailor their programs to local needs, but it also creates significant differences depending on where someone lives. Whether those differences represent flexibility or inequality depends largely on your perspective. For now, the important point is simply this. Before discussing how America's healthcare system should change, it helps to understand that we already have a large, successful, and remarkably complex public healthcare program operating in every state. The question is not whether government has a role in healthcare. It already does. But Medicaid is only one example of government involvement in American healthcare. The next program takes a different approach, covering people not because of income, but primarily because of age.